recently gave a talk to a group of international magnesium researchers where we went into the cardiovascular disease death rate as being the #1 killer, really, both nationally in the United States and globally, and it has been going up. It's been #1 for the last 2 decades, and it's continuing to go up. And we talked about why this is, because of the rise in body weight of humans all over the world, the obesity epidemic, which has been happening since 1980. When the body gets larger, we have found that the magnesium requirement goes up, because about 8% of the body is blood, and that doesn't change. If your body weight goes up, the blood volume goes up to correspond to it. And so you have to have more magnesium to handle all that heart muscle tissue and blood vessel tissue, for which magnesium is crucial in order for the blood to flow in that, and the musculature that both pumps the blood in the heart and controls the blood pressure in the blood vessels. Magnesium is key to the proper functioning of all of those muscles. So, as we get larger with an obesity epidemic, the amount of magnesium that everybody needs to continue to have a healthy cardiovascular system and a healthy heart goes up. But our magnesium intake in our foods and in our water have been going down, because the processed food diet that is spreading around the world at the same time is going down in magnesium intake. On a traditional diet of growing your own things and grains and nuts and non-processed things, it's easy for an adult to get 600 milligrams magnesium a day. They're surrounded by those kinds of foods. But the usual intake among the modern societies in Europe as well as in North America are more around 200 to 300 milligrams a day. Less than half the magnesium coming in with our diets. And so we are all suffering from a low magnesium diet. And that's why we have these death rates that are so high and climbing of cardiovascular disease, stroke, hypertensive heart disease, other cardiovascular disease risk factors, and of course now type 2 diabetes, which has been added to this. This is in addition to the hunger from what we have always called protein-calorie malnutrition. Generalized hunger is going down in the world. It's been going down in the world for the last several decades because we've been producing so much more food. But the food that is going out there, because of the high processing, being able to buy it in a store with packaging and so on, is going down in magnesium and the other minerals too. And as a result, we're seeing this widespread growth of cardiovascular disease and diabetes. And that's why getting the proper amount of magnesium, either in your water, with an oral supplement, or with a transdermal magnesium cream, can really give you sustainable health. Because the magnesium in your body, if it's at an optimal amount, then your magnesium is like the mother lode of the other minerals. It's going to handle the sodium and the potassium balance much better than if you have low magnesium. It's going to handle the calcium that you take in, even with supplements, getting it into your bone, keeping it out of your soft tissue, putting it into the right places. And then the other trace minerals that can be low, as long as you get enough of those, but not too much, then the magnesium is going to be able to make sure that you have a healthy diet and a healthy body. If you happen to take a little too much of these trace minerals, which you can do, because you need them in such small amounts, if you get too high, it starts to become less than optimal. If you have enough magnesium, then your liver is so much better able to handle the extra input of those extra minerals or other toxins in general. And it helps the liver to optimize your body and excrete all of those toxins as you detoxify the body. So getting enough magnesium is really important, and we're not getting enough, and supplementation can really help out a lot.